think we moved to the last part of the session, but the most key one. It's my privilege to introduce Dr. Srinath and call him on the stage. We have a invited expert talk by him on AI-driven research and healthcare roadmap. As you come on the stage, sir, I'll quickly introduce you as well. Dr. Srinath is the head Sri Shankara Cancer Hospital and Research Center. He's a senior consultant surgical oncologist and head of the institution Surgical Oncology at Sri Shankara Cancer Hospital and Research Center, Bangalore. He is also the managing trustee of Sri Shankara Cancer Foundation, done his MS in general surgery and FRCS from Glasgow and Edinburgh with 70 plus publications as a lead author. He is honored with Karnataka Rajyotsava Award for Outstanding Service in Medicine. Previously received UK's ORS Award for Cancer Immunity Research. I think I can go on and on. A very impressive, long introduction. He also enjoys playing table tennis and was a university level debate champion. I think I should bring in this because generally, as doctors, we perceive there are people who are very serious, have no other interest apart from clinical interest. So I wanted to bring this to you. Over to you, Dr. Srinath.
Good evening to all of you. I was here yesterday, the inaugural session, and the speakers following that it was very motivating and very useful to all of us. Today, in the limited 20 minutes of time that I have at my disposal, let me quickly run through the role of AI in transforming medical care. During the last one and a half decades, we have seen tremendous amount of AI research in AI and development of many tools in the healthcare delivery system all over the world. I feel that it's only that we are lacking behind. When I read the journals, when I read the transformation that is happening in industry, in research, I feel that at least India is a decade backward, and we have a lot of journey to do and catch up with what is happening around us in the world. Before I go into that, I just quickly want to introduce the institution where I am working. Shankara Cancer Foundation was established in 2008 as a not-for-profit organization. We established 2 cancer hospitals. One is 12-year-old, and that is Bangalore Sri Shankara Cancer Hospital and Research Center. And the other one more recently in Bhubaneswar, Bakchi Sri Shankara Cancer Hospital, Cancer Center and Research Institute. Both of them are above 500 beds. They are the largest charitable cancer hospitals in the country today. And the impact that we have done, we have treated almost more than 102,000 patients during the last 10 years. And of that, nearly 44,000 plus patients have received some form of help, support, financial or otherwise, in undergoing treatment. And we have spent nearly 140 crores of rupees in treating the poor patients and providing them financial support. Now, during the last 3 years itself, we have given money to the tune of about, last year it was 19.7 crores, before that it was 18 crores, the year before was 13 and odd crores. And we have 3 important pillars in Shankara Cancer Hospital, in Shankara Cancer Foundation. Apart from the nursing college, the Allied Sciences College, and CanAid, a voluntary organization, we have 3 important pillars. One is, as I said, Sri Shankara Cancer Hospital and Research Center and the Bakshi Sri Shankara Cancer Center in Bhubaneswar. And the third one is Sri Shankara National Center for Cancer Prevention and Research. I'm just trying to let you know what the work we are doing. We have put equal efforts in all the 3 arms of clinical service, community oncology and cancer prevention, and the third one is laboratory research. Now, some time ago we adopted two talukas, Gauribidanur and Chintamani, total population of 5.8 lakhs. We have identified at least 2.5 lakh adult people who are amenable for screening against cancer, and more than 50,000 people have so far received some form of clinical evaluation, either mammography, clinical examination for breast cancer, for oral cancer, or for carcinoma cervix, that is the pap smears and other studies. And of these, 161 patients were detected to be having cancer during the last 3 years from this 5.8 lakh population. They were brought to Shankara Cancer Hospital in Bangalore and they were treated free. Apart from that, what we did was we adopted one technique, that convincing the patients to come to Bangalore and get the investigation done, or come out of the house and have the clinical evaluation done and get convinced about prevention of cancer is almost very difficult. Particularly, it's a challenge in the rural population. So we thought that we should treat them at site, whenever we see them, advise them to undergo treatment. So we have taken a laser equipment in our own bus and we have started operating them in the oral cavities. The precancerous conditions were excised through laser and they were submitted for pathology examination. And in a way, by advising these patients, de-addiction programs and others, we have been able to save at least 2,000 people from developing into active cancer. Now, the third arm is actually what I said is about molecular research. We have all the equipments that are required in a research laboratory. We put utmost importance in the progress of understanding of cancer, and for that we have spent a lot of resources in establishing an advanced cancer center, cancer research institute. We have mass spectroscopy, we do next generation sequencing of all the patients, we have flow cytometry, we have tissue culture, and we also have fish testing. We don't send any specimen outside the institution for doing the work, for diagnosis as well as for research. During the last 5 years, we have seen more than 180 publications done from our research institute in international journals, and we have 60 ongoing research projects as of now. And every postgraduate student and every consultant working in our hospital is actually involved in some active research, laboratory research of one kind or the other. We are an institution recognized by ICMR, DSIR, and other institutions. We have multiple global collaborations and also in India, such as Mayo Clinic, Maastricht University, Cancer Research Institute in London, and here in India we are a member of Indian Cancer Genomic Atlas, National Center for Biological Sciences, Manipal, Mahe, and Indian Institute of Science. We actively involve these in various research activities. And now I come to the crux of the issue, and that is, let me take quickly through the challenges that we face in the field of cancer management or cancer care. Now, as most of you are aware, cancer is the second most common killer in our country. We have more than 1.4 million patients. That's an older data. It may now be about 1.7 or 1.8 million new cancer patients being diagnosed every year. And of them, we lose almost 1 million patients. And it affects both sexes. And what is going to happen in the next 25 years? If we can project that, we will see some trends. What we know now from the international IARC data, we know now that in the next 25 years, the incidence of cancer is going to double. Not just that, we may see about 2.8, 2.9 million cancer patients in our country, and there is going to be some change in the shift of the type of cancers that we are going to see. We see breast and lip and oral cavity more commonly now, but by 2050 you will see bladder and prostate and lung cancers going to be more common. There is going to be a change in the trend of cancer incidence. But whatever it is, the issue is that we need to address is not only the challenge of volumes of cancer patients. I can understand that the patients are going to, people of today who are aged around 35, 40 are going to age in another 25 years, and more geriatric patients you are going to see. And you will see more incidence of cancer naturally. And of course, cancer is a lifestyle disease. We do expect that cancer is going to increase even that. So, considering that, next slide please. What is it that we are going to see and what are we seeing now? Today, 3 out of 4 patients are diagnosed in late stage of disease. Is that likely to change? Maybe a little bit, but I don't really see that, as we do not have a properly structured national level cancer prevention strategy which reaches the rural people. It is not likely that our people's mind will change and we are going to have a different outcome. So I still feel that the incidence will be slightly higher. Can you go back? Yeah. Another thing I would like you to see is this. Please study this, the approximate 5-year survival. It has been very dismal. With all the modern technology that we have as of today, the survival, 5-year survival for oral cancer is only 45%. Ovarian cancer, which is very common, is 50%. So the cervical cancer is only 55%. We are far away from what is acceptable for in terms of the outcome of our own treatment schedules that we have. Next slide, please. Now, are we spending enough in trying to find out good treatment options before us? Yes. It is not in India, but all over the world. When you take the globe as a focus, 70% of funds spent on research is spent on cancer, research on cancer. And you can see that, I will not go into the details. They are spending drug discovery 41% and cancer biology 55%. These are going to be the 2 important areas. Even in future, people will be focusing to try and get a translational research to get an answer for achieving better outcomes. Next slide, please. Now, this is one slide. Don't get dismayed by what I have shown here. This is a paper published by Tata Memorial Hospital, one of our leading cancer centers in the country. Now, they did an economic survey and they tried to study what will happen. What is the cost involved in treating a oral cancer patient? What will be the result and what will be the damages? Oral cancer, due to premature deaths in oral cancer alone, I'm not talking of the overall cancer, alone, every year India loses $5.6 billion. Now that means it kills the younger people, it reduces the productivity, it reduces the wealth of the nation, it reduces happiness. The cost, some are measured, some are not measurable. But at the end of it, what is measurable is what is seen here, and that is nearly $5.6 billion every year. Now that should actually put us into worry. Why? What are we really doing? Are we doing enough? I don't think We need to put our heads together and try to find an answer to this. Now, what are the options that we have? Certainly, the most important, and although it is difficult to implement, the most important solution that I can think of is prevent cancer. I mean, if you can prevent cancer, there is nothing like it. There are many areas. Now, I am now looking at the induction of artificial intelligence in coming out with solutions for our challenges. I will deal with that. Now, preventing cancer is one of the most important challenges ahead of us. I think the country as a whole should create awareness among the people, citizens, make them responsible for their own self, and educate them, and then see that the cancer incident change the lifestyles to ensure that this can be discussed at a greater length. But I can simply, just to give you one example, you can't swing the cradle of the child and also prick it. You can't actually keep on selling tobacco and cultivate tobacco and then also say that tobacco causes cancer. I think there has to be some sense of responsibility among the civic society as in demanding these things to happen, and also with the government should understand the importance of what the society is going through. Now, money is not everything. Unless the governments of the day put the responsibility that lives are more important than money, this problem will not be solved. Just prevention of cancer, I leave it at that. Then let me quickly go to the development of vaccines. Cancer is a very heterogeneous disease. Now, what I mean by that, for the engineers who are here, at different sites of cancer tumor, you find different genetic attitudes. Now, the thing is, it's a heterogeneous tumor. Some areas may respond to chemotherapy while other areas continue to grow. So, unless you have a homogeneous tumor which behaves uniformly all over, your treatment options are likely to fail. And over a period of time, what you are going to see is the host body, will continue to grow only resistant tumor cell lines, which will be difficult to treat. Now, developing vaccines is a challenge. It's not easy, but at least where we know, we have made some headway. For example, in hepatitis B virus infection, which causes liver cancer, by immunizing the people and preventing hepatitis B virus infection, we can certainly reduce the incidence of liver cancer. Thailand and Hong Kong, where there were addicts, drug addicts in the past, has seen large incidence of hepatocellular cancer. Now, I am afraid we may see the same thing in Punjab and other areas. Now, similarly, we have a solution for carcinoma of cervix in Western countries. Many of the Western countries do not see any carcinoma cervix because there is mandatory vaccination against HPV virus. Unfortunately, the male members in Western countries who do not undergo, because they don't undergo vaccination, they develop oral cancer. Hepatitis, human papilloma virus infections causing oral cancer is very common among men in the Western countries, whereas tobacco is the cause in our country. Now, having said that, these are the two examples we have, but I think in the long run, in the future, some of the institutions will be definitely focusing on, already research is going on. We are closely watching what is going to happen in the field of developing vaccines against cancer. Now, let me come to the use of AI to improve the outcomes of cancer treatment. I have put it a very broad terminology here. 5 minutes, okay. I knew you would be asking me that. Now, other than just reading the headlines, I don't think I will have enough time to explain. But let me tell you, in the prevention of cancer, we have tremendous options. we have used large scale epidemiological data in trying to identify who are the people who are at risk of developing cancer. It is again a LLM model. So I think one can do research in this area and try to find an answer. There is another point to it. If we can develop some easily low cost models by which we can examine the patient and predict the cancer or detect the cancer. For example, we have a one handheld device being developed in our institution, which has got different white and blue and green lights, through which they will be able to repeatedly, by taking data on examining various patients and annotating those who have got cancer among them, we can develop a model for early detection of oral cancer by simply putting a torch or the camera and taking out the images and examining them. Now, radiological imaging was one of the first earliest to come under the AI purview. These images are fixed, they are specific to the disease, easy to annotate, easy to examine under for large scale, and so lot of this one we have lot of tools for early diagnosis of lung cancer. Even by taking a chest X-ray now, using AI tool, you will be able to determine where the lung cancer is. Now, radiomics is another thing. Now, by studying the images that are taken, say CT scan or an MRI or even a PET CT scan, and studying the features of those closely and comparing them with the outcome of results, now we are trying to, in various hospitals abroad, they are trying to identify which are the high risk cancers, which are poorly differentiated cancers, which are the cancers who are less likely to respond to therapy, and what should be the solution, what is the answer. Now I think this is a very exciting area for us to study, and I think India should take it because we have large number of these readily available for examination. Now, digital pathology is another thing. We have digital pathology in our hospital. It improves the accuracy of diagnosis. It makes comparison very easy, and it is also has extensive scope for artificial intelligence analysis of various digital data for subdividing or subclassifying the tumors and getting a better outcome. Now, molecular diagnostics is a very big field today. Unfortunately, I am not able to elaborate on that. I think we can discuss it. Those who are interested, I don't see many engineers here. Most of them are from my institution. So I am going to talk to them anyway. So the thing is, the important thing is molecular diagnosis is something that we need to focus on. A lot of data is actually comes out of the various investigations, multi-omic analysis that we do on all cancers, and sitting together, if we can compile and then do data analytics, I think meaningful solutions will come, and we have not done that yet. It is an open challenge. Any one of you who are interested, postgraduate teachers, if there are anybody here, they can send the students. If they are interested, they can come and join us. I will, while summing up, I think I will skip this. This is very important. I'll just talk to you about this. Drugs. Until now, drugs have been, all the medications have been selectively approved for against specific cancers. Now we find that the drugs are being administered against various other diseases, agnostic of the diagnosis, but more of the molecular behavior and genetic behavior of the tumor. So these laboratory insights that we get is going to charge us with a different knowledge, with which we will be able to identify the most appropriate drug. And so thereby we can, by repurposing the existing chemotherapy drugs that are available with us, we may be able to get better cures and results. Now, the prediction of mortality in critical care patients. This is another challenging area which will be very interesting. Now, we see a lot of patients in the critical care department who the trend, by studying the trend of those patients, how they respond to various treatments, will we be able to tell the community, tell the relatives that this patient is likely to succumb to the disease? What is it possible for us to predict well in advance what is going to happen so that they don't really spend a lot of money? And is it possible? I think this is easily possible if we can apply AI in what we are doing. We are already doing 3D modeling in enhancing accuracy of the surgical planning. Our head and neck team is here. They are doing jaw reconstruction using 3D modeling. They do jaw a day, a new concept. It's already going on, but there are other areas where we can do much even more. We need to sit with CAD/CAM engineers and AI people and then try to develop new models of treatment. Now, by taking CT and MRI and PET CT scans and developing a 4D model on that, in very complex surgical procedures, we can do the navigation of the surgery using these AI tools. Now, just few days ago, just day before yesterday, we had an extremely complex surgical procedure. The CT scan was very depictive, yet the surgery was very difficult. So the thing is, if you can get this understanding, then I think using AI, we should be able to navigate very complex, particularly brain tumors. We are already doing, but in other cancers, we should be able to do. Now, I would like to leave this. I think another thing that I want to tell you is this. The last but one slide. How do we communicate with the patient and get the best out of them? Can we actually convince the society that this should be your most appropriate behavior? Is it possible to do? I'll just give you an example. When our clinical psychologists went and talked to the tobacco addicts and tried to convince them, definitely they gave up tobacco for 3 or 6 months and then again they went back. It was not something that... So our field workers decided that we have to do something else. Now, our doctors who work in Chintamani, they decided to go to the schools. They started addressing the school children in larger number and telling them the effects of tobacco and how they should convince the parents to give up smoking. Now, suddenly our results of tobacco cessation increased to 20%. Now, I think there are ways and means by which you should be able to use your AI and try to change the behavior of the people. Is it possible? I think sociological behavior, human behavior is extremely complex. I think we need to study that and work with the people and study that and try to change and motivate them. I think that is something that the 5 minutes in the limited time that I was given, I think I have done what I could. Finally, I just want to tell you this. India is, in my own opinion, I do not know about others, but we are far behind in accepting and adopting AI for improving the lives of our people. I think this solution is long neglected. We are talking of it, we are reading it in journals, we talk in the conferences and meetings. It is not practically implemented at the floor level, whether it is in the village, in the town, in the college, in the hospital. It is not implemented. There is tremendous scope for us to do it, and we have taken it up in our hospital. We have more than 1 lakh patients' data with us, and this is most of it is electronically recorded, which is easily curated, and you can improve the quality of the data that one can see, so that it becomes amenable for AI questioning and the queries that we want to do. You can raise the various questions, and I would welcome. You can spread this to others. I would welcome organizations, individuals, and scientists, professors who are working in various engineering colleges. They can approach us. We have an open door. They can come discuss with us. We have at least about 25 options in front of us for AI. We have enlisted, but I don't think we can take all of them together. We do not have that bandwidth, but at least we can start in a small way. Maybe 5 or 10 of them can be taken at once and then start improving it. I think I must express my gratitude for giving, for the Matrix organizers to giving me this great opportunity to present before you what I thought about AI. I think we will have some kind of discussion in the future among the AI members, I hope, among the Matrix members, and then try to see what we can do in this area. Thank you very much for your patient hearing. I will come down.
We run totally out of time.
I will come down. I can discuss. Certainly, I will be happy to answer.
Thank you, Mr. Srinath, for that insightful session. I would like to call upon Ms. Ritu Sharma, Executive Director of TIE Bangalore, to give away the token of gratitude.
So this just because I just want to make an announcement here. Yeah, I think I have a very interesting announcement to make. So I have been in the ecosystem for quite some time, sir, now. And I think there are more than hundreds of startups working in oncology in India. Biggest challenge is they don't get a partner hospital to work. So here we have a hospital who's ready to open their doors for startups to work, innovate, solve the problem. So from TIE, I think from the healthcare SIG, we are going to shortly announce a deep engagement program where we are taking the onus of facilitating right from the problem statements from Shankara to do a loud call for applications for startups, curate, enable these conversations. I think we are opening up this program we are happy to handle this for you, sir.
Thank you so much.
Thank you.
Thank you very much.
I think next few weeks, I think the program will go live. Yeah, look forward for some announcements from our side. Thank you, sir. Thank you so much. Wonderful. Sorry that we had to cut short the time.
Don't. Thank you.